8 in 10 American hospitals still receive patient records by mail or fax, not as an emergency backup, as a normal working method. That isn't a guess. It's the federal government's own survey number from 2025. So your medical records have been faxed, probably this year, probably more than once, and nobody mentioned it to you. And on the other end, a person printed them out and typed them back into a computer by hand. Okay, so the obvious reaction is that healthcare is just behind. Old industry, slow to change. Nobody's got around to it. That's not what happened. The United States spent nearly $29 billion specifically to fix this. It worked, and the fax machine survived anyway. Let me make it make sense. Start with the money. In 2009, Congress passed the HITECH Act. The deal was simple. Doctors and hospitals get paid, real cash, to buy computerized medical records and use them. By the time those programs wound down, CMS had put about $28.7 billion into it, and on its own terms, it worked. In 2008, fewer than 1 in 10 American hospitals had an electronic record system. Now it's 99%. So the computers are there. They're just not talking. To see why, look at what the law asked for in return. The statute says a provider has to show their system is, quoting directly, connected in a manner that provides for the electronic exchange of health information. Which sounds exactly like interoperability. It isn't. The reason is in how you prove it. The same statute says you demonstrate this to the satisfaction of the secretary through a process the secretary picks, such as the use of an attestation. An attestation, you tick a box. And when the government went back and checked those boxes, the HHS Inspector General estimated that CMS had paid out $729 million to professionals who didn't meet the requirements. The reason given, they hadn't kept records supporting what they had attested to, and CMS had barely reviewed the paperwork. Then there's the exchange target. In 2012, CMS wrote the rules for Stage 2 of the program. The draft version said you had to electronically send a care summary to a provider outside your own organization and outside your own software vendor, which is the real test. Can your system talk to a stranger's system? In the final rule, CMS took that out. What they kept in their words was at least one instance of exchange with a provider using EHR technology designed by a different EHR vendor or with a CMS-designated test EHR. One instance, once. And you were allowed to do it against a test system the government ran instead of a real hospital. That's the bar. The whole cross-vendor test came down to a single message, possibly to a machine. Second piece, and this is the one almost nobody knows, fax isn't just tolerated under the privacy law, it's the easiest legal thing a hospital can do. HIPAA has a security half. That's the part with the encryption rules and the audit logs. And it applies to exactly one thing, electronic protected health information. So go and read how the regulation defines electronic. It's 45 CFR 160.103. It lists hard drives, disks, memory cards, the internet, leased lines, private networks. And then it says this, certain transmissions, including of paper, via facsimile, and of voice, via telephone, are not considered to be transmissions via electronic media if the information being exchanged did not exist in electronic form immediately before the transmission. So you print the chart out of the computer, you feed the paper into the fax. Under that definition, what you just sent was never electronic. It isn't electronic protected health information. And the entire security rule doesn't reach it. It gets easier still. Sending records to another doctor for treatment doesn't need the patient's signature. And the minimum necessary rule, the one that says only share what's actually needed, explicitly doesn't apply when you're sending to a provider for treatment. So put yourself in a compliance office. Option 1, send it electronically, and now you're in encryption standards and audit trails and breach exposure. Option 2, print it and fax it, and legally you have done almost nothing. Nobody picked fax because it was good. They picked it because it's the option with the least law attached. Third piece, and this is the ugly one. In 2015, Congress asked the Federal Health IT Office a direct question. Is somebody deliberately blocking this data? They wrote back a report. Most of the complaints, it said, were about the software vendors, and they were about pricing. Vendors charging fees that make it cost prohibitive for most customers to send, receive, or export electronic health information. Some charging a fee every single time a user sent, received, or looked up a patient's record. And the report names why that works. Ripping out a record system is brutally expensive, so hospitals are stuck where they are. In its own words, those switching costs make it easier for developers to engage in information blocking without losing existing customers. The phrase it uses for the pricing is opportunistic pricing that exploits locked-in customers. Sit with that because it turns the whole thing around. If your data is easy to move, your customer can leave. If it's hard to move, they can't. Making records portable was a feature that made the product worse to sell. The report's own summary of the behavior. It may be economically rational for some actors in light of current market realities. And then, at the back, they put worked examples. Scenario number 1 is 2 competing health systems. Both bought certified software. Both took the federal money. Both are completely capable of sending records electronically. And one of them has a policy. We will only send this competitor's patient records by fax. The verdict, one line. That organization is likely engaging in information blocking. That's the federal government, in a report to Congress, writing the fax machine into the definition of the problem. Not as a symbol of being old-fashioned, as the tool you reach for when you want to technically comply and practically obstruct. There's a footnote calling faxed records expensive, old-fashioned, unsecure, and error-prone due to re-entry. And those records are often hundreds of pages long. So Congress did act. The 21st Century Cures Act made information blocking illegal in December 2016. The rule spelling it out became applicable in April 2021. If you're a software vendor or a health information network, the penalty is up to $1 million per violation. That's been live since September 2023. As of this summer, no vendor has publicly been fined. And if you're a hospital, the statute deliberately doesn't do that. Hospitals get referred for what the law calls appropriate disincentives, and those had to be written separately. That rule took effect in July 2024, 8 years after Congress banned the thing. The disincentive is that you lose 3/4 of your annual Medicare payment increase. Now, I want to be fair to the facts here because the case for it is stronger than people admit. It works. Every clinic, every pharmacy, every nursing home has one, and it works between all of them. There's no account to set up, and nobody has to check whether their system speaks the same language as yours. It's legally simple, for every reason I just went through, and it doesn't depend on anything staying up. In February 2024, Change Healthcare, which handles a huge share of American medical billing, got hit with ransomware. The number of people affected, as reported to the government, is about 192.7 million. The largest health data breach in American history didn't happen to a fax machine. It happened to the digital system built to replace them. Hospitals went back to paper and phone calls, and they kept treating people. A fax also gives you a receipt. It went to that number at that time, and a page came back saying it landed. But here's the cost. The information arrives as a picture of a page, so no computer can read it. Someone retypes your allergies and your medication list into a screen. And every time a person retypes a medication list, there's a chance of getting it wrong. You can see the damage in the numbers. In 2023, 71% of hospitals said outside clinical information was routinely available to them electronically at the point of care. Only 42% of clinicians actually used it. The data arrives. It's just not in a shape anybody can work with. So the machine in the corner of that ward isn't a relic somebody forgot to unplug. It's the shape of the law. It's what's left when you pay for adoption instead of connection, and when you write a privacy rule that makes paper the safest option. The companies holding the data never had a reason to make it easy to move. It's the cheapest way to be compliant and unhelpful at the same time. And if you work in healthcare, you already know whether I've got this wrong. Maybe your hospital sorted this years ago, and the fax is genuinely just for the one nursing home that won't upgrade. Maybe it's far worse than I've made it sound. So what actually comes off your fax machine, and how much of your day goes into typing it back in?